Welcome to this short webinar on prevalence of food insecurity in southwest Western Australia. What is food security? Well, it's all about physical, social and economic access to food, and that food needs to be safe, so free from pathogens and harmful bacteria that make us sick, and also nutritious, so the food that meets our dietary needs. So it has a range of micro and macronutrients, and it also needs to meet our food preferences for an active and healthy life. So not only does it need to be safe and healthy, it also needs to meet the types of foods that we like, either through taste preferences or cultural food preferences. We ran a survey with consumers in Southwest WA in 2020, and this is just a broad overview of their typical demographics. So as you would see here, about 2/3 of them were 51 years and above. Most were female. About 2/3 had 2 adults in the household. The majority had no children living in their household, and also a large majority completed TAFE or a university degree. Almost 3/4 of our respondents were married, and about 40% were retired, unemployed, or employed but not working. And then a large proportion, so almost 80%, said that they had a disability or health condition, and 85.8% said that they were the main shopper in the household. So we used this survey to understand the prevalence of food insecurity, the impact of COVID-19 on their purchasing behaviours, and also their perceptions of changes to the food supply. This is our typical consumer respondent. We'll call her Mary. She's 51 years old and married, has 2 kids, lives at home with her hubby, and she's got a tertiary degree. She's retired or not working, and she has a health condition and the main shopper of the household. So just bear this in mind when you're interpreting the results or the findings from this work. We had, in our survey, 1 in 5 community members were categorised as food insecure using the USDA Food Security Survey module, the 6-item short form. So that was 1 in 5 people within this region during the COVID-19 pandemic. And this is quite a lot higher than the general estimated prevalence in Australia, which is about 4 to 5%. When we broke down the food security status into the different severity levels, we found that almost 80% had high food security, but then 8% had marginal food security, 7% low food security, and 6% very low food security. So you can see how that does differ in terms of whether people were worried about where their next meal was coming from or worried about running out of food, to then cutting down the amount of food that they are consuming. So it can go from the types of response behaviours can be as simple as, well, not simple, but worrying about where your next meal is coming from, and then also changing the quality of your diet or the types of foods in your diet, to then actually going to cutting down the amount of food that you're eating, which is a more severe form, and then of course avoiding meals or not actually eating meals altogether as the most severe form. We also took into consideration a number of demographic factors that I presented a little bit earlier, because we wanted to see whether those factors, along with different statements around how COVID-19's impacted food supply, would impact someone's food security status. So we did some statistical modelling where we included a number of demographics and also different statements in a model, and we found that being of a younger age and having a disability or health condition significantly predicted someone being food insecure. And then in addition, the statements that impacted food insecurity the most were agreement that COVID-19 had impacted food price, the person's shopping frequency, and also their money available to buy food. The behaviours that were used to mitigate food insecurity, 12.3% said that they ate less than they felt that they should because they didn't have enough money for food. Over 10% said that they cut meal size or skipped meals, and 3 community members said that that happened between 7 and 10 times or days in the previous month before they completed the survey. 1 in 10, almost 1 in 10, said that they didn't eat despite being hungry within the previous month. So these types of behaviours relate to reducing the food quantity rather than the quality, so the range of type of food or different types of food groups, say, due to a lack of money. When we considered lots of different statements in the one statistical model, we found that a significantly higher proportion of food insecure people strongly agreed that COVID-19 had impacted these factors. So the type of food available, with food price, quality, how much food they purchased, the types of foods that they bought, where they bought food from, how frequently they went shopping, how much money they had available to purchase food, the way that their food was stored, how much they wasted within their household, and the way that food was prepared or cooked. So the proportion of people that were food secure reporting that COVID-19 didn't have any impact at all on the food that they bought and ate was significantly higher than people who were categorized as food insecure. What are some recommendations that are arising from this research? Well, a couple that have been included here include plan for future food system disruptions. So we need better contingency planning for when pandemics or crises happen, so we can make sure that we are enabling everyone, regardless of their background, to access nutritious, safe, affordable food. We also want to see local businesses supported to create a food emergency response. So developing food security emergency frameworks that articulate how much food that you need to be food secure for the number of people in your household, for example, where you can get food from, and then how we can integrate different government and non-government agencies together to connect them better in the response effort. And then involving other departments that have frequent contact with vulnerable groups is really important. So broadening the scope and amount of the money that's available through the social support system to improve people in times of crisis. And funds could be given specifically for purchasing food when it's required and upskilling professionals in that area. So I hope you've enjoyed this brief webinar investigating food insecurity in the Southwest region during the COVID-19 pandemic.